Welcome to Brainetainment, your one-stop channel for all things educational, intriguing, and mind-boggling. We're here to shine a light on the fascinating corners of knowledge, to challenge your thinking, and most importantly, to entertain that brain of yours. Today, we're taking a close look at a topic that's often overlooked, yet plays an important role in many lives: male birth control, and more specifically, we're focusing on the procedure known as vasectomy. Now, you might be wondering, what exactly is a vasectomy, or how does it work? Well, that's exactly what we're here to explore. We'll be delving into the nitty-gritty of this medical procedure, breaking down the science behind it, its effectiveness, and much more. So, whether you're here out of curiosity, for educational purposes, or even considering the procedure yourself, we've got you covered. Stay tuned as we dive deep into the world of male birth control and demystify the concept of vasectomy. When we hear the term birth control, many of us instinctively think about women, but did you know there's a highly effective birth control method for men too? It's called vasectomy. So what exactly is a vasectomy? Simply put, it's a surgical procedure aimed at male sterilization or permanent contraception. This might sound quite serious, but it's actually a straightforward and relatively quick procedure, usually taking less than 30 minutes to complete. During a vasectomy, a healthcare professional will block or cut the vas deferens, the small tubes in your scrotum that carry sperm. By blocking these tubes, sperm produced in the testicles can't make their way into the semen. It's important to note, however, that a vasectomy doesn't stop the production of sperm. It merely prevents sperm from being part of the ejaculation process. The procedure itself is usually done under local anesthesia, meaning you're awake but you won't feel any pain. The doctor makes small punctures or incisions in the scrotum to reach the vas deferens. Once accessed, these tubes are then either cut, tied, or otherwise sealed. This effectively creates a roadblock in the path that sperm take from the testicles to the urethra. In the grand scheme of things, a vasectomy is quite a minor surgery. Most men can go home the same day and return to their normal activities within a week. Of course, as with any medical procedure, it's important to follow your doctor's advice on recovery. Now, you might be wondering, does this affect sexual function? The answer is no. A vasectomy has no noticeable impact on a man's sexual drive, ability to have erections, sensation of orgasm, or ability to ejaculate. The only difference is that the semen won't contain sperm, thus preventing pregnancy. In essence, a vasectomy is a simple and effective way for men to take charge of birth control. It's a relatively quick procedure with minimal recovery time, and it offers a high degree of reliability in preventing pregnancy. It's a choice that more and more men are considering as part of their family planning strategy. Now that we know what a vasectomy is, how exactly does it work as a method of birth control? Well, let's take a closer look at the process. A vasectomy is a surgical procedure that involves blocking the vas deferens, the tubes that carry sperm from the testicles to the urethra. This is usually done under local anesthesia, making it a relatively painless procedure for the patient. The surgery itself is fairly straightforward. The doctor makes 1 or 2 small incisions or punctures in the scrotum, through which they can access the vas deferens. They then cut or seal these tubes, effectively blocking the pathway for sperm. But what happens to the sperm produced by the testicles after a vasectomy? They are simply absorbed back into the body, causing no harm or discomfort. Now let's talk about the effect of this procedure on the male ejaculation. Some people may be under the impression that a vasectomy impacts the volume or appearance of the semen. However, this is not the case. The majority of the fluid in ejaculation is actually produced by the prostate and seminal vesicles, not the testicles. Therefore, after a vasectomy, the semen will look and feel the same, but it will no longer contain sperm. That's the crux of how a vasectomy works as a method of birth control. By preventing sperm from reaching the semen, fertilization of an egg during sexual intercourse becomes impossible. It's important to note, however, that a vasectomy doesn't provide immediate protection against pregnancy. Sperm can remain in the vas deferens above the blockage for some time after the procedure. So, other methods of contraception should be used until a semen sample confirms the absence of sperm. So a vasectomy essentially prevents sperm from being a part of the ejaculation process, hence no fertilization, no pregnancy. It's a simple yet highly effective mechanism, making vasectomy one of the most reliable forms of birth control available today. You might be wondering, is vasectomy a foolproof method? What are the chances of pregnancy after a vasectomy? Vasectomy as an approach to birth control is highly effective. In fact, it's one of the most effective methods available, putting it at the top of the list alongside options like intrauterine devices and contraceptive implants. But here's the thing. No method of birth control, vasectomy included, is completely foolproof. In general, vasectomy has a stellar track record, with less than 1% of men experiencing a pregnancy after the procedure. That's right, less than 1%. To put it in perspective, that's about 1 in every 1,000 men, a remarkably low figure. This statistic is based on a time frame of 1 year following the procedure. After that, the chances of pregnancy drop even further. Now, how does a vasectomy fail? There are 2 primary ways this can happen. The first is during the initial few months after the procedure. This is because some sperm may remain in the vas deferens, the tubes that carry sperm from the testicles. It's essential for men to use another form of birth control until their semen is tested and confirmed to be sperm-free. The second way a vasectomy can fail is through a process called recanalization. This is a rare occurrence where the vas deferens manage to grow back together, allowing sperm to mix with semen once again. This can happen months or even years after the procedure. However, it's important to note that this is extremely rare. In essence, while vasectomy is not 100% foolproof, it's as close as you can get with current medical technology. The instances where a vasectomy might fail are few and far between, making it one of the most reliable birth control methods available today. While no birth control method is 100% foolproof, vasectomy comes close with a very high success rate. Now, we've learned quite a bit about vasectomy today, haven't we? Indeed, we've embarked on an engaging journey, dissecting the concept and intricacies of male birth control with a particular focus on vasectomy. It's been an enlightening discourse, wouldn't you agree? Let's quickly revisit some of our key takeaways. We began by defining what a vasectomy is. We learned it's a simple surgical procedure for permanent male fertility control. The operation involves severing or sealing the vasa deferentia, the small tubes in a man's body that carry sperm, which effectively prevents sperm from reaching the semen that is ejaculated from the penis. We then explored how a vasectomy works. We found that the procedure is typically quick, often lasting only about 20 to 30 minutes, and can be performed under local anesthesia. It's generally considered a safe procedure with minimal complications. Post-vasectomy, men can still ejaculate and have an orgasm, but the semen won't contain sperm, thus preventing pregnancy. Our discussion then delved into the effectiveness of vasectomy. We discovered that it's one of the most effective forms of birth control available. Although no method is completely foolproof, vasectomy has a less than 1% failure rate. That means less than 1 out of every 100 men who get a vasectomy will get a woman pregnant in the first year after surgery. However, it's essential to remember that vasectomy does not offer protection against sexually transmitted infections or diseases. Throughout our discussion, it's been underscored that birth control is a shared responsibility. It's not just up to one gender to bear the burden. Men have a role to play too, and vasectomy offers an effective permanent solution for those who have made a clear decision not to have more or any children. Although vasectomy has its advantages, it's essential to have open, honest discussions with your partner and consult with a healthcare professional to make an informed decision. It's crucial to consider all factors, including your current lifestyle, future plans and overall health, before deciding on any form of birth control. In the grand scheme of things, the more we know, the better choices we can make. Knowledge empowers us to take control of our lives, including our reproductive health. It's important to remember that each person's journey is unique. What works for one may not work for another. But having the right information at our disposal allows us to make decisions that are best for us and our loved ones. Remember, knowledge is power. And on that note, we wrap up today's Braintainment session. Don't forget to subscribe for more enlightening content. Until next time, keep feeding your brain with Braintainment.